It's one of those things we sort of feel compelled to bring you up to date on stories like this, right? Because it's important. So, Quebec's National Assembly in the process right now of adopting presumed consent when it comes to organ and tissue donation. We did this, I think, when the story first came
Andre
up months
Fortin.
ago, right?
Yeah.
Andre Fortin, the Liberal critic here, bringing this up, saying how important it was. Well, it's being discussed now. Dr. Marc Germain is Vice President of Medical Affairs at Héma-Québec, and he's on the line. Dr. Germain, thanks for being here this afternoon. Can we talk about the process right now, where we are and where we're likely to end up, and how long will it take to get there, from what you understand?
In terms of presumed consent, you
Yeah,
mean? Well, before we go there, maybe explain why. Maybe your audience is a bit puzzled by the fact that it's someone from Héma-Québec who's talking about presumed consent
fair
for
enough.
organ and tissue donation.
Mm-hmm.
But I think it's important to know that, of course, I think most people are well aware of the need for organs for transplantation. We're talking about kidneys, lungs, hearts, liver. But something that less well known is the need for tissues for transplantation. And when we talk about tissues, we talk about corneas, for example, that can be grafted to restore vision. Skin grafts that are used to treat burn patients and very often save their lives. Heart valves that are used to treat congenital malformations, bones and tendons. So all of these grafts, and there are more than 5,000 years that are performed in the healthcare system in Quebec. And so that's under the responsibility of Héma-Québec. Organs are dealt with by Transplant Québec, but that's why I'm talking to you today about this very important issue. Now, in terms of the question you're asking, it's been quite a while now that a lot of people have been discussing the notion of going for presumed consent as opposed to the current situation, which is an opt-in system. Opting in meaning that we need to ask the family when someone dies, are you in agreement that we take organs and tissues? Or we go in the registries where people have had the chance to tell us that, yes, they're in agreement with giving their organs and tissues. So that's opting in. Whereas in the presumed consent model, is the reverse. We presume that someone is in agreement unless that person has decided to opt out, either by, again, going into a registry and saying very clearly, I don't want my organs and tissues taken for transplantation, or that the family reports that, oh no, our loved one didn't want to go there. So that's what's on the table. It's been discussed for 3 days now in Parliament, and the consensus seems to be that in and by itself, going to a presumed consent model is not going to help much. There needs to be other steps to be taken if we want that option to be even neutral. It could be that it won't make a change. If it does increase the rate of donation, it will need to be accompanied by other measures. And if you want, we can discuss that. But that's the basic message that we heard through these testimonies at the National Assembly.
Dr. Germain, whenever we talk about this idea of presumed consent, we do get some pushback from some listeners, people who are uncomfortable with the idea of it and feel like it could be taken advantage of. I wonder if you'd like to say anything to people who have concerns.
Well, I mean, if we ever decide to go through a presumed consent model, and if some people are still reluctant and really don't want to go through that, then they will have the option of opting out. But they will need to be proactive in doing that, by going into the registry or making it very clear to their family that they don't want to become an organ or a tissue donor when they die. So they will have the option to say no, but it will need more effort on their part to go there. But that's one concern about going to a presumed consent model. It's that some people will say, hey, I never understood that I needed to opt out, or the family will say that most likely. And so that's why there is this concern that if we go too fast in such a model without the proper safeguards, in particular, we want to make sure that we have a very good registry in which we can in which people can make their wishes very well known in advance, and that registry needs to be easily accessible. It needs to be modified whenever someone changes his or her mind. So unless we do that, there's the risk that, as you're saying, some people might become quite reluctant to go in that with that kind of model.
Just as a final question, though, I would ask, because I know when we first talked about this is not unique to us, right? This model works in other places around the world. Obviously, we will look at how it's doing in other places. Do you know this kind of model working other places doing well?
Well, you mean the presumed consent model?
Yeah. Mm-hmm.
Nova Scotia just recently, I think it's not more than a year ago that they switched to an opting out model. There are some countries, for example, in France and Spain, that have been working with this model. It's not clear that it makes a difference in terms of the number of donations. That's one concern with this. I mean, in some countries, it really didn't make a difference. Mm-hmm. In others, it's not clear whether it's this particular change that was responsible for an increase in the number of donations. But there is experience elsewhere. I think we need to look closer to the experience, especially in Nova Scotia. We don't know the details yet of how it was deployed and the impact of this. I think it will be very important to follow that. But yes, other places have gone there. Most countries are still with the system that we have in place now, which is an opting-in model.
I think this is a great initiative. I'm so glad to hear that Héma-Québec is behind it. Thank you for your time this evening.
Thank you.